Social Security is a program that provides financial assistance to millions of Americans. It helps those who are retired, disabled, or have lost a spouse. Recently, the Trump administration has proposed significant changes to Social Security Disability Insurance, or SSDI. These changes could have a major impact on the lives of millions of Americans who rely on these benefits. The proposed changes have sparked debate and concern among lawmakers, advocacy groups, and beneficiaries alike. The heart of the issue lies in the administration's proposal to introduce a new category for evaluating disability claims: medical improvement likely. This category would be added to the existing three-tier system used to assess eligibility for disability benefits. Currently, the Social Security Administration, or SSA, evaluates disability claims based on the likelihood of medical improvement. The three tiers are not expected, expected, and possible. Under the proposed change, individuals falling under the medical improvement likely category would face more frequent reviews of their eligibility for benefits. This means they would need to demonstrate more regularly that they still meet the SSA's criteria for disability. The administration argues that this change is necessary to prevent fraud and abuse within the system. They claim it will ensure that only those who truly need assistance receive it. However, critics argue that the proposed changes represent a significant departure from the program's original intent. They express concern that the medical improvement likely category will disproportionately impact individuals with chronic conditions. These individuals may experience periods of relative stability, followed by flare-ups or exacerbations of their conditions. Critics fear that the new category will create unnecessary hurdles and potentially lead to the unjust termination of benefits for vulnerable individuals. The current Social Security disability system operates on a three-tiered evaluation process. This system aims to assess the likelihood of medical improvement for individuals applying for disability benefits. The first tier, not expected, applies to cases where medical improvement is not anticipated. Individuals in this category typically have severe, permanent disabilities. They receive benefits without scheduled re-evaluations of their eligibility. The second tier, expected, encompasses cases where medical improvement is anticipated within a specific time frame. Beneficiaries in this category undergo periodic reviews to assess their progress and determine if they still meet the criteria for disability. The frequency of these reviews depends on the nature and severity of their condition. The third tier, possible, is assigned to cases where the likelihood of medical improvement is uncertain. These individuals receive regular reviews to monitor their condition and adjust benefit levels accordingly. The proposed medical improvement likely category would insert a new level of scrutiny into this system. It would target individuals whose conditions are not expected to improve significantly but might show small signs of progress. This new category raises concerns about the criteria used to determine likely improvement and the potential for subjective judgments. The frequency of reassessments for individuals in this category is also a point of contention. Critics fear that more frequent reviews will create administrative burdens for both beneficiaries and the SSA. The proposed changes to Social Security disability benefits have sparked widespread concern about their potential impact on individuals with chronic conditions. Chronic conditions such as heart disease, cancer, and diabetes are long-term health problems that often require ongoing medical management. These conditions can significantly limit an individual's ability to work and maintain financial independence. For many individuals with chronic conditions, Social Security disability benefits provide a vital lifeline. These benefits help cover essential expenses such as housing, food, and medical care. The stability provided by these benefits allows individuals to focus on managing their health and maintaining their well-being. However, the proposed changes, particularly the introduction of the medical improvement likely category, threaten to disrupt this stability. Critics argue that the new category could subject individuals with chronic conditions to frequent and unnecessary reassessments. This is because chronic conditions often involve periods of relative stability, interspersed with flare-ups or exacerbations. Even during periods of stability, individuals with chronic conditions may still experience limitations that prevent them from engaging in substantial gainful activity. The Trump administration's proposed changes to Social Security disability benefits have ignited a heated debate about the motives behind these policy shifts. While the administration maintains that the changes are necessary to safeguard the program's integrity and prevent fraud, critics view them as a thinly veiled attempt to cut costs and reduce the federal deficit. The proposed changes come at a time when the Social Security program faces significant financial challenges. The aging of the baby boomer generation and rising healthcare costs have placed a strain on the system's resources. However, critics argue that targeting individuals with disabilities, who are among the most vulnerable members of society, is not the solution to these challenges. They point out that the Social Security disability insurance program has a relatively low rate of fraud and abuse. Furthermore, critics express concern that the proposed changes will ultimately cost more than they save. The administrative burden of conducting more frequent reviews and processing appeals from individuals whose benefits are terminated could outweigh any potential savings. They argue that instead of implementing these harmful cuts, the government should focus on finding long-term solutions to strengthen the Social Security program and ensure its solvency for future generations.